Ladies and gentlemen, welcome to this free nuclear science and technology webinar held by ANET, Asian Network for Education in Nuclear Technology. And this network was established in 2004 and fostered by IAEA and has been running for 20 years. ANET has a learning platform with various nuclear science and technology learning materials. And you're welcome to visit ANET through the web portal or other social medias. You will learn more information about our upcoming free webinars. For today's webinar, we are honored to have two speakers from Malaysia. If so,
Yeah.
our first
Yes.
speaker will be Dr. Nora.
Okay. Thank you, Prof. Can you hear me, Prof. Xiao Jing?
Yes.
Okay,
I would
now,
like to give a very short, very brief introduction of Dr. Nora.
okay.
Okay, she's a senior lecturer in the Department of Imaging, Faculty of Medicine and Health Sciences, University Putra, Malaysia. She got her PhD in medical physics in 2012 from the University of Surrey in the United Kingdom. And she is awarded as the 10th best researchers in her faculty, and she was also awarded as the 9th National Seminar on Medical Physics Best Poster Session. Thank you. The floor is yours, Dr. Nora.
Okay, Assalamualaikum warahmatullahi wabarakatuh, and good morning, good afternoon, everyone. Thank you for Prof. Zia Jing for introducing me. Today, I'm going to share with all of you regarding about the applications of radiation in medicine. So at the end of this lecture, I hope all the participants will be able to describe the utilizations of radiation technology in human health or in medicine in achieving the Sustainable Development Goal 3, SDG 3, particularly in diagnostic and therapeutic treatment. So this is the content of my lecture today. Firstly, I will give briefly about introduction, a bit radiation dosimetry, radiation technology in medicine, ray of hope summary, and some of references. As we know that there are two types of the radiation sources, including the natural sources and also man-made sources. For the natural sources, we can it is mainly contributed by the cosmic, terrestrial, and also internal radiations. And for the man-made sources, actually it contribute more likely like X-ray being produced in the X-ray tube, and also cesium-137, cobalt-60, and radium-90, which is artificially produced in the nuclear reactor. So if you look, we can see from this chart, we can see most of the stuff of radiation being used in the medical procedure. So as a recap, actually, what does mean by radiations? Radiation is a general term used to describe emission and transmissions of energy through space in the form of wave, including charged and uncharged particle, as well as electromagnetic radiation. So it means that when you are being exposed with the radiation, actually you are being transferred or given the energy. So the simplest thing that what we can describe radiation is energy. So there are two types of radiation when it is come to the human body, which is one we call as the ionizing radiation, and the second one is non-ionizing radiations. For the ionizing radiation, usually it can cause the ionization when it is interact with the patient's body or human. So means that it capable to breaking the molecular bonds and displace or remove electron from the atom, which can cause the damage to living tissue. As for in medical, usually general X-ray, computer tomography, mammography, and nuclear medicine is used the ionizing types of radiations, whereas for non-ionizing radiations, NIR, so it does not cause any ionization when it is interact with the patient body, because the deposited energy is just enough to excite electron from the lower to the higher states. Example of the non-ionizing radiation, which also used in medical, is the magnetic resonance imaging and also the ultrasounds. So a bit about radiation dosimetry. Usually when we talk about the use of the radiations in medical, usually we will need to understand a bit more about the units that has been used in medical. Usually we use the becquerel, which is the unit that indicating the amount of the radioactive in the body, if like say, or produced by the nuclear reactor. So after that, we do have the sievert, which is the unit of radiation exposure, those that a person receive associated with the radiation's effect. Because we know that the radiation also can give an effect, either it is being exposed to higher levels of doses or the lower level of doses. And then the third one is the absorbed dose, gray, or sometimes we call it a joule per kg, which is the amount of energy absorbed joule by a substance of unit mass kg that receive the radiations. Usually, for the we also talking about the equivalent dose, which is give a unit of sievert, and also effective dose, which is also give the unit of sievert. But the variations between these two, actually, for the equivalent dose, it take account the difference of types of radiation you are being irradiated. Either you are being irradiated with the alpha or beta or gamma or neutrons. Whereas for the effective dose, it take count the sensitivity among the organ, because we know each organ have the different sensitivity towards the radiations. Like in the breast, it's more sensitive to radiations compared with the skin when you are being exposed with the radiations. So of course, usually in order for us to convert from the gray to sievert, because we want to estimate the radiation's effects, this is how actually we do. Usually we do have the absorbed dose, we multiply with the radiation's weighting factors to get the equivalent dose. After that, we will multiply again with the tissue weighting factor. And then after that, we will get the effective dose, which is the unit is sievert. So based on the applications of the nuclear science and technology in the field of healthcare, particularly in the context of the SDG 3, which is good health and well-being, it is involved to primary area, which is medical imaging and also radiation therapy. Usually for the medical imaging, it is involved with the positron emission tomography scan, and also single photon emission computed tomography specs. So actually, I will further discuss about this during my slide on the nuclear medicine. And then the second one is about radiation therapy, which is also for the cancer treatment. And then, as we know that in radiotherapy, the difference between the medical imaging, actually it utilizes the very high energy X-ray or gamma ray, which is could be generated from the missions and directed at the tumor site. Sometimes we also use the naturally made sources, sometimes also to kill the tumor cells, but that one is a source based. And then the goal actually to damage the DNA within the cancer cell, preventing them from the dividing and growing. So actually in the radiation therapy, sometimes we divided it into two types, one external beam and another one actually internal. So for the external beam, usually it is involved with the using of the linear accelerator, and then lots of the advancement in technology using the linear accelerator, including the IMRT, intensity modulated radiation therapy, stereotactic body radiation therapy, SBRT, which is allow for more accurate targeting of the tumor while minimizing the damage to the surrounding healthy tissue. So whereas the second one is actually using the source, okay, where actually we utilize the radioisotope for targeted treatments such as brachytherapy. I will explain furthermore later on. So as we know, radiations in medicine, it has been used in medical widely for diagnostic and also therapeutic. For the diagnosis, usually this is the equipment has been used to diagnose the disease of the patient, including the general X-ray that we use, computed tomography, positron emission tomography, single photon emission computed tomography, fluoroscopy, mammography, and dual X-ray absorptiometry, which is DEXA. And for therapeutic, usually we will use the linear accelerator, tomotherapy, gamma knife, interoperative radiation therapy, CyberKnife, brachytherapy, and blood irradiator. All of these kinds of modalities actually is really depend on the different purpose and also different disease. So that's why you need to know what the source of your radiations. So like in diagnostic radiology, because the aim actually to just for imaging the disease, usually we will use in the kV range, kilovoltage range. For example, that general X-ray, we will use 20 kV to 150 kV, whereas for the computed tomography, it's utilized the energy 40 kV to 180 kV. And then for the MEMO, it is about 18 to 49 kilovoltage. This is the range of energy that we use in diagnostic radiology, very low energy range. However, for the radiotherapy, because the aim actually to kill the cancer cell, so that's why it is utilized high energy, because we know that most of the cancer cell will be deeply seated in our body. That's why we need more penetration. So that's why we will use a higher energy, which is we will use a mega voltage. Usually for the radiotherapy, there are two types of the beam. For the photon beams, 6 MV to 18 MV. Usually it is treated for the deep-seated tumor. Usually we will use a photon beam, whereas for the electron beam, for the superficial cancer, so like a skin cancer, we will use the electron beam 6 MV to 20 MeV. And then we also have the source-based irradiator, which is using the cobalt 60, which is the energy is 1.0022 MeV. And nowadays we have a particle therapy, which is for proton. We have the more than 150 MeV. This is just for example. And then for the nuclear medicine, the energy could be from the keV to MeV. It really depends, because nowadays we do have the hybrid imaging, which is combinations between the imaging and imaging for the diagnostic purpose for the positionings of the structures and also for the functioning. That's why by combinations of this hybrid imaging, that's why we will have the energy range from the keV to MeV. Like a CT used in the nuclear medicine, usually 40 keV to 150 keV, whereas for the SPECT CT, because it utilized the technetium-99m, so the energy is about 140 keV. And then for the PET, positron emission tomography, usually we use the fluorine-actin FDG, which is the energy is about 0.5 MeV. So now I move on to how actually the radiation technology in human health in diagnostic radiology part area, where actually we know that diagnostic radiology is the study of the images of the human body, which is requires some form of energy to produce the image. So mainly actually we would like to produce the image. That's why different types of medical images can be made by varying the types of energy and the acquisition technology used, and all of them are referred as a modality. So each modality in diagnostic radiology have its own applications. For example, radiographic procedure, usually we like to image a particular organ or tissue in 2D or 3D. 3D, usually we talk about the usage of the computed tomography, where actually we being able to view the image in 3D plane. And 2D, usually for the chest X-ray, we use the general X-ray. For the fluoroscopy diagnostic procedure, usually it will provide real-time assessments of the anatomy and also the pathology of the system or organ, like the urological urological and also gynecological. So, and then to image a lesion in the breast, usually we use the mammography machine. Whereas for the digitally subtraction angiography DSA, we can see the image of the blood vessel in the brain to detect a problem with the flow, or we are going to image our heart vessel. Yeah. That's why this is, we can see this is just only for a diagnostic purpose. This is what the working principle behind all these diagnostic modalities, like in X-ray. To get the image, we will use the electromagnetic wave, and then this is all the modalities that use the electromagnetic wave to perform or produce the image. All these kind of modalities, we call it is the transmission imaging, because the way they acquire the radiation or to convert it to image, actually it is based on the transmissions of the X-ray from the X-ray tube, and then interact with the human body. After that, reach to the detector to produce the image. So that's why we call as the transmission imaging. For the sound wave, actually to get the image in ultrasound, we use the sound wave principle, where actually we get it from the reflected back of the echo to the transducer to get the image. That's why they call as the reflection imaging. But the sound wave actually fall under non-ionizing radiations, as I mentioned before. And then whereas for the MRI and gamma ray, actually we use the emission imaging, because all the signal has been will be emitted out from the patient's body, reach the detector to get the image. This is the principle, working principle for the emission imaging. For example, when we injected the patient with the unstable radionuclide into the patient's body, because the radionuclide is unstable, it tends to be stable by emitting the gamma ray. So the gamma ray will be detected by detector to form the image. So this is three basic principle modalities that use in diagnostic radiology. As you can see here, all the technique and acquisitions of diagnostic radiology mainly use the X-ray tube, where to produce the X-ray and interact with the patient's body. As I mentioned before, the application would be various, and then it's really depend on disease, what disease would you like to see or diagnose. Like if for the vessel-based disease, usually we will use angiofluoroscopy. However, for any bone structure, bony disease, we will use the computed tomography, because the computed tomography also can give you a 3D view, where actually you can see clearly. You can avoid any overlapping tissue if you use the computed tomography, whereas for the X-ray, it's just 2D projections. That's why there is some of the fracture might be missed if you don't perform any or more than one or two projections for projected X-ray. Yeah? That's why doctor will favor to use the computed tomography if, let's say, they want to see many view compared with the projection X-ray or the general X-ray. And then for to image the breast, we will use the mammography, because it is utilized very, very low energy compared with the others modalities. After that, we acquire the image. Of course, we will send to post-processing, and then after that, it will be displayed and be interpreted by the radiologists. So, and then let me bring you to my hospital to see the diagnostic radiology modalities. I hope all of you can hear the sound. This is the generic X-ray. Please can believe just on 2D image. blood clot in the vein in the blood. And this is the ultrasound. This is compression. This is the thermocline. And then this is the machine. The magnetic strength. Then this is a fluoroscopy. If you want to see any pathological, you can see we have the stone, like kidney. Okay, now I move on to the productions of radionuclide. Actually, most of the radionuclide used in medical, it is the artificially produced. So mainly we can produce the radionuclide using three methods. One we call as the nuclear reactor, generator, and the cyclotron. For the nuclear reactor, because I don't want to explain in detail, usually for the nuclear reactor, the product that we will produce is the molybdenum-99M, chromium, selenium, yttrium. Yttrium usually we'll use further at the hospital to treat the prostate cancer. Whereas for the generator, technetium-99M generator, usually we will insert the molybdenum to the generator because it is easier for us to use at the hospital. So this is the our generator, technetium-99M, that we bought from Turkey, where actually we know over the time molybdenum-99 will decay to the technetium-99M, and then this technetium-99M will be injected to the patient's body. After that, it will produce the gamma ray, which will be detected later on with the detector. And then we also have the cyclotron in Malaysia, where actually we will use to produce like fluorine-18 FDG, which is used in the PET CT scan. So this is the three method that we will use to produce the unstable radionuclide to be used in medical. Like what is nuclear medicine? The nuclear medicine actually use a small amount of the radioactive material for diagnosis and also treatment. Usually, we call them most of it as a molecular imaging, where actually it will reflect biological process that take place at the cellular and also subcellular levels. It is evaluate the physiological functions rather than anatomic structures. That's why the hybrid comes in order to helps on the atomic structures. For the nuclear medicine, usually we will use the radiopharmaceutical agent that has been trace amounts of radioactive attached, and then the radiations emitted from the patient is imaged by the gamma camera, which is SPECT or PET CT. So this is a patient's body. When we inject the patient body with unstable radionuclide, so the unstable radionuclide tend to be stable by releasing the gamma. So this gamma will be emitted out and reach the detector. After that, it will be display the image. That's why we have to combine or hybrid with the CT. Therefore, we can know the specific locations of the tumor or the cancer cell. Because for the SPECT itself, it just can evaluate the functional functions rather than the anatomical structures. This is the common radionuclide that has been used in nuclear medicine. And then more likely the application that we can do using all this kind of radionuclide is for the staging of the cancer cell, to see the functions of the heart, and also for the infection disease, or sometimes we can use it for the treat the thyroid cancer using the iodine 131. So there are two methods how actually you can deliver the nuclei into the patient's body, either use the injection or intravenous administrations. Usually we use the technetium 99M, or by inhale the gases like Crepton 81M. So this is how actually the process, how the drugs and imaging device used to diagnose the disease. Of course, we have to prepare a radiopharmaceutical we take with the unstable radionuclide like technetium 99M. So after that, we will inject to the patient's body. And then, of course, the uptake of the radionuclide will be specifically localized in the tumor. Since the radionuclide is unstable, it tends to be stable. It will releasing the gamma ray, and then the patient will be positioned on the couch and put in the SPECT or PET-CT. After that, the gamma ray will be emitted out from the patient body and then detected by the detector. So after that, the doctor will do the diagnosis of the patients. So this is example, the gamma camera, yeah, SPECT-CT, and also PET-CT. In my hospital, we do have the SPECT-CT. However, for the other center, also in UPM, we also have the PET-CT scan. So as I mentioned before, nowadays in nuclear medicine, we do have the hybrid imaging. We combine between the PET-CT, SPECT-CT, and also PET-MRI. Why? Because we want to fuse the image of the anatomy, and also we can also get the informations on the physiology. That's why we will superimpose the image that we obtain from the CT scan and also PET to get both CT and also PET. However, you have to bear in mind the dose also will be double. The dose to the patient from the CT and also from the PET. So this is the comparison between the radiology, why actually we call as the transmissions imaging, and then why in the SPECT we call emissions imaging. And then I think I will play a bit in my hospital how the image has done lesson. Okay, now I move to the radiotherapy, but I will give briefly about that because I think the next speaker will be deeply discusses about the radiation technology in human health, which is the radiotherapy. This is the major modalities that has been used in radiotherapy, which is the linear accelerator, and then tomotherapy, gamma knife, IORT, cyber knife, brachytherapy, and also black irradiator. Usually, in radiations for cancer therapy, it is predominantly generated to means which is LINAC and also the radioactive sources. LINACs actually a device that accelerate the charged particle electron to velocities near the speed of light, using the oscillating electric field to push the electron through a series of the accelerating cavity. So the most of the modality used in radiations oncology is the external beam radiotherapy. And although a small number of radiotherapy facilities generate external beam using the radioactive sources, such as the cobalt-60. However, the vast majority of therapeutic electromagnetic radiation is generated in a LINAC, linear accelerator. What is a LINAC? So, as I mentioned before, LINAC use a very high energy in the range of the 4 to 25 MeV. Okay, mega. However, for diagnostic radiology, we use the kilo EV, kilo voltage. Okay, and then why? Because because we know that when we use the high energy, it will capable to ionize atom and molecule inside the nuclei of the biological cell of the tissue, to which the radiations is applied, thus killing the cancer cell by damaging their DNA. That's why the majority of the radiation treatment use the X-ray photon, and also a small number use the electron or combine of both therapies. It really depends on the oncologist. Either they want to use photon beams only, or they want to combine X-ray and also electron beam. Okay, usually the electron beams are specifically used for the superficial tumor or skin cancer, which is less than 5 cm deep. Others more than 5 cm deep, we will use the photon beams. So that's why some of the LINACs in Malaysia, usually they will have the option either you want to use the photon beams or you want to use the electron beam for the cancer treatment. So this is a difference between the linear accelerator, which is use the photon production mode, or electron production. The main difference just only where actually for photon production, you will introduce the target, target, which is tungsten, where actually the electron beam will be bombarding to the target and producing the photon beams. Whereas for the electron beam, you just remove the X-ray target to produce the electron beam, which is straight forward to utilize the electron beam. That's why this mode can be used in one LINAC only. Okay, we know the advancement in radiation technology in radiotherapy, which is the proton, cyber knife, conventional RT, is why actually you can spare more the normal tissue. If let's say for the proton beam, you can spare more normal tissue compared with the conventional RT. Or in cyber knives. That's why most of the country nowadays, they towards to have their own proton therapy. Like in Malaysia, we don't have yet, but I think these other country like Thailand, in Indonesia and Singapore, they already have a proton therapy, and also Japan. So, and then the others use of the radiations in therapy, actually one of it actually a boron neutron capture therapy, when the drugs and neutron being combined. In this case, usually we will inject the non-radioactive radioactive boron-10 isotope to the through the IV. After that, the boron will accumulate in the cancer cell. After that, we will expose the tumor region with the neutron beam. Of course, the boron will capture the neutron, and then the boron-10 will decay and producing the alpha and also the lithium-7 nucleus. And this alpha actually will go and interact with the cancer cell. We know that the alpha particle is a very short length travel. That's why it can damage all the cancer cell in a very precise and also effective. Okay, and then usually the treatment time is about 20 minutes. And then we also have the gamma knife stereotactic radiosurgery COBAX-60 source. Use a brain surgery where we have it in the Clinical Hospital Kuala Lumpur, which is usually it is used because we doesn't want to have the normal or open operations where actually we want to avoid the opening of the skull to remove the cancer or tumor brain. That's why we use the COBAX-60 as the source of the gamma radiation beam, which is we arrange it in the semi-cellular container so that all the beams point towards the center of the circle. So you can see here where actually we have the COBAX-60 sources, and then also we have the shielding to make sure we can shield properly the gamma. And then of course usually it is very specific area the brain being treated because they have the helmet, special helmet to hold the patient to move their head during the treatment. So, and then the others, internal radiation therapy, use of the cell source to destroy the cancer cell because as the brachytherapy. Usually there are lots of the kind of the disease that can be treated using the brachytherapy. One of it actually breast cancer. Usually we will combine with the surgery after the lumpectomy, and then we will do the brachytherapy. It really depends on the oncologist's preference. So this you can see where actually the source will be in this machine. After that we have the catheter or insert where actually we can place it via surgical in the breast or in the tumor site. You can see where actually it is a very invasive procedure, and then usually it is used to treat the early stage breast cancer, which is not separated or metastasized to the other part of the body yet. And then sometime after the brachytherapy, we also combine it with the external beam radiation therapy like LINAC, as I mentioned before. This really depends on the preference of the oncology. Usually there are lots of the brachytherapy doses. Either it's really depend on the oncology to prescribe the doses. Either they want to prescribe the high dose in 1 hours or in a short time. So we will use the high dose rate brachytherapy. So this is how actually we insert the seed catheter. So, and then after that, IEA actually helping a lot through the initiative or Ray of Hope in fighting the cancer, where actually the aim actually to enhance the cancer care by providing the sustainable and effective solutions. So that's why the primary focus of Ray for Hope is to address the challenges that might develop country face in dealing with the increased burdens of the cancer. And then IE actually will support of the country by establishing the first radiotherapy center in some of the low and middle income country. And also a part of that, they will provide the training, workforce, procurement, equipment, support regional insurance center, and also fostering the innovation through the research and educations. This is to make sure that all the country actually do have the accessible to the cancer treatments. So this is the package that has been offered by through this initiative. You can read more later on. So as summary, we know that radiation is essential in medicine, providing the important diagnosis images and effective treatments. And then the contributions of radiation technology such as nuclear medicine and radiotherapy aligns with the SDG 3 by improving the diagnostic capability, enabling early disease detections, facilitating target and effective treatment, and ultimately enhance overall health outcomes. By continued these advancements of this technology, we hope to improve the post diagnostic precision and also therapeutic effectiveness. However, we have to bear in mind that responsible and ethical use of this technology is crucial to ensure that the safety of the patient and also the environment. This is my acknowledgement and list of reference. With that is conclude my presentation today. Pass over to you, Prof.
Thank you.
Welcome.
Thank you, Nora. Thank you
Yeah.
for your impressive presentation. You talked about the nuclear technologies utilization in medicine. That's very impressive, especially the videos about what you did in your hospital. Thank you very much. Okay.
Welcome.
Next, I will invite Dr. Hafiz. Yes, Dr. Hafiz is Associate Professor in Advanced Medical and Dental Institute, University SAS, Malaysia. He got his PhD from University of London. His research interest is to translate the application of novel image sensor and the radiation detector into the radiotherapy clinic. The primary focus of the work is to improve targeted radiotherapy treatment of cancer using optimized image guidance modalities and real-time multi-leaf colorimeters tracking. Research projects of current interests are three. He has 3 products under research now. Next, Dr. Hafiz, the floor is yours.
Thank you, Prof. Xiaojing. I hope you can hear me.
Excuse me, would you like to say something about the feedback?
Thank you, Prof. Xiaojing. It's a pleasure to be here today. And thank you, Anand, for organizing this excellent webinar. So let me first share my slide. So today, I'll be sharing about this program from INSTA, which stands for International Nuclear Science and Technology Academy under the IEA, which focusing on radiation in medicine, with the focus on enhancing education, collaboration, and multidisciplinary practices for human health. So this program is actually under planning. So the details that I'll be presenting probably will not be exactly the same when we offer this course, but we welcome your feedbacks if you have any at the end of the presentation. But I'll be sharing the link here just in case if you have time to scan first. Later, you can actually fill in the survey form. So you're welcome to join this course. So if you find what Dr. Nora has presented to be interesting, so this is something that you can further into to learn more about application of radiation in medicine. So my slide will cover why we organized this course, also the program objectives and learning outcomes, as well as the components and activities of the course. So as what been presented before, you can see that radiation plays an important role in the prevention, diagnosis, and treatment of health conditions, especially cancer. So the field involves actually multidisciplinary practitioners and researchers, thus requiring trainers and educators to have in-depth training in the multidisciplinary environment to produce next generation professionals. And the educators or trainers involve also a multidisciplinary team from basic to clinical sciences and practitioners. So there are people from different disciplines involved in ensuring the success of application of radiation in medicine. So I'm going to show you a video of a radiotherapy linear accelerator. So you can see that's the illustration of the beam coming from the linear accelerator. So this is a high energy X-rays being delivered to the patient, and it is also being collimated to focus only to the cancer region inside the patient. So as you can see in this image here, so there has been improvement in the technology of radiotherapy delivery, where we are now actually focusing delivering very focused radiation to the target because of the advances in the radiation delivery technology, as well as the advances in the imaging guidance technique, where we have an onboard imaging system to guide the machine to deliver radiation precisely to the target. And like Dr. Nora mentioned as well earlier, that we also now, instead of delivering X-rays, we can also deliver particle beam, for example, proton and carbon ion. So these have some advantages for certain type of cancer that is radio resistance to X-ray. We also now can deliver radiation to moving targets, so that we can deliver precisely to target inside the body that is moving. For example, if you think about our respiratory motion or breathing, so your lung will be moving throughout this radiotherapy treatment. So with advances in imaging technology, we are able to see where the tumor in real time, and then we are able to actually deliver radiation precisely to the tumor while it's moving inside your lung. And that's how normally image-guided radiotherapy system works. So you have an imaging system. In this case, you have another CT scanner inside the radiotherapy room. Sometimes we also have an imaging system built into the linear accelerator. So as you can see on the side of this linear accelerator, there are X-ray imaging system on board that can be used to image the patient during treatment. And then there are also other types of radiation that we use, for example, particle beam, proton and carbon ion to treat cancer. On top of that, we have a multidisciplinary team to deliver the treatment safely to the patient, and also to perform imaging on the patient. So for example, in a radiology or imaging department, I'm sure most of us have been to this department. So we have the radiologists, the technologists, as well as the physicists that work together to ensure the safety of the imaging done on the patient. So in terms of the job scope, radiologists would start with the radiographer. So the radiographer would help in taking the image from the patient. So the radiographer would position you in an appropriate setup. And then once they get the images, then they'll be sent to the radiologist to diagnose if there's any problem in the body. And then the person that is working in the background is the physicist. They are the one that ensure the machine is performing as it should. So they will do specific quality assurance tests. For example, they will ensure that the dose delivered to the patient is within the safety limit, and so on. So in the other department, for example, in radiation oncology, where they treat patients with cancer using radiation. So there is the radiation therapist to help position the patient during imaging and also during treatment. And there's an oncologist that will prescribe how much radiation that we want to use to treat the patient, as well as the physicist to ensure the safety of the delivery. So they all have important roles that are distinct from each other to ensure the safe delivery of radiation to the patient. And in terms of the qualification, because they are doing different roles. So I'm sure they have different education background as well as training background. So and these are the things that is important. In some countries, they might have the machines, the modality, but they might not have the human resources to operate the machine safely. So this is another important aspect that we have to ensure being set up in the country. So for example, for a physicist, so they would need a degree in physics or engineering, and then a postgraduate degree in medical physics, followed by clinical training to ensure that they can perform the clinical roles safely in the hospital. And the reason that these are important because if these are not done appropriately, so there could be potential harm to the patient. So for example, you might find it surprising in country like the United States. There were reports of radiation accident where the patient actually died because of the failure of delivering the radiation safely to the patient. In this case, what happened was the linear actuator that was supposed to deliver a very focused beam to treat the cancer inside the nasopharyngeal area of this patient actually was open. So the beam was not focused during treatment, and the patient received a lot of dose, much higher than it should. So, and unfortunately, the patient actually died after a week of receiving the treatment. So the program is proposed to increase knowledge in the advanced practice of radiation in medicine among the tertiary education lecturers, to provide an in-depth understanding of the multidisciplinary environment that I mentioned earlier, and then to exchange experience in education and clinical training of the next generation of radiation medicine practitioners and researchers. So the school will cover the core knowledge and curriculum, radiation technology for health application, medical and health education approaches, cancer diagnosis and treatment, as well as community and public health. So this is an example of the activities that we will conduct at the school to provide an in-depth understanding of the multidisciplinary environment of radiation medicine application for the benefit of human health. So we cover the basis of education and training of all the professionals involved, as well as the aspect in terms of the public health and also cancer diagnosis and treatment, and how we use radiation in medicine appropriately. Next, we also cover the core knowledge, like you have actually seen in the previous lecture, how what are the modality used, how they are used for imaging and also for treatment of patients. Then, because it will be performed on site, you have the opportunity to visit all the departments to understand what has been taught in the lecture better, as well as you can also get some glimpse about what are the research being carried out in improving and optimizing radiation imaging and therapy. So beside that, we also have a hands-on session where the participants would have opportunity to work with the instruments involved in radiation in medicine, as well as look into the teaching tools that the educators use to deliver the education in radiation medicine effectively. So these are the institutions that we involve. So we plan to offer this in Malaysia over a period of about 2 weeks. So it will involve Universiti Sains Malaysia, Universiti Kebangsaan Malaysia, Universiti Tunku Abdul Rahman, Universiti Putra Malaysia, Universiti Teknologi Mara, and also our National Cancer Institute. So each of the institute will have their own focus and deliver the parts of the overall program that we plan. So for example, to deliver the core knowledge and curriculum as well as radiation technology for health application, these are the planned activities. So we have lecture on the education and training components, as well as visit to the radiation facilities that you can see here in our center in Penang, Malaysia. So we able have the opportunity to visit the imaging department where you saw the CT machine earlier. This is normal X-ray radiography. This is dental X-ray machine. This is another CT machine that we use for radiotherapy, and this is the radiation therapy machine. So we also have the opportunity to observe, to explore the clinical research aspect, especially application of detectors for imaging and dosimetry. Then we also would have a session at the National Cancer Institute where we zoom into cancer diagnosis and treatment. So we'll have the opportunity to see how the multidisciplinary approach happens in a cancer hospital. We also have the opportunity to visit their cyclotron facility, as well as how the radionuclides are being prepared. And last but not least is on the teaching aid. So in UC Technology Mara, Malaysia, we can see how a VR is being used to train the healthcare scientists and also medical students on specific subjects in radiation medicine, as well as ability to observe and visit and also understand the principles of using CT on a benchtop system. So that's it. So this is the last slide. So we hope that if you are interested, then you'll be able to join us to join the school that we'll announce sometimes later, maybe at the end of this year, and come visit Malaysia. So I would appreciate if you can provide feedbacks with regards to what I've presented. So maybe you can have a suggestion on what are the components that you probably think that be important in the school. With that, thank you.
Thank you. Thank you, Dr. Hafiz, for the great presentation. And you also introduced this Insta School, Radiation in Medicine. I think that's why you asked whether there are students, maybe they will be interested in this Insta School. And as Dr. Hafiz mentioned, in the chat box area, we posted the feedback link. So please feel free to give us your feedback to make our webinars better. Thank you. Next, we will come to the question and answer section. So if you have any questions to Dr. Nora or Dr. Hafiz, please raise your hand and you will have a chance to talk to the professors. Or you can also input your question in the chat area so we can read your question. Okay, actually, I have a question to Dr. Nora. During your presentation, you played 2 videos. And in one video, I saw that there is a patient who is being inspected by CT, and the doctors helped him to fit in. And during the inspection, it seems that the doctors stayed in the room with the patients. So I wonder if the radiation dose is safe. Usually when I was in the hospital, the doctor is in another control room, maybe. Only the patient stays in the room. So is it the dose very, very safe for the doctor to stay there? Thank you.
Okay. Thank you very much, Prof. Actually, the video that you referred to, it is a nuclear medicine procedure, where actually usually the person, 2 of the person actually is not doctor, they are operator. So they also are classified as a radiations worker. So when they are classified as radiations worker, they wearing the special badge, which is can monitor their dose. As a radiations worker, the limits of the radiation dose that they can receive is 20 millisievert per year. So that's why Actually, because we know in nuclear medicine, the radiations is continuous because when we injected the radio nuclide into the patient's body, the patient itself itself is the source of the radiations, emitting continuously the gamma ray from the body to the detector. So that's why in order for the workers, the radiations worker dealing with the patients, instead of wearing the radiation dose detector for monitoring, they also have to apply the radiation protection principle, which is 3 things, which is justification, optimizations, and dose limit. But in the case of this optimization, they have to apply 3 things, which is time, distance, and also shielding. If you look at the radiation worker, they are not wearing the leg gown. If you go to the hospital, some of the procedure they wearing leg gown, but in this case they don't wearing the leg gown because the gamma ray that being used in the nuclear medicine is very penetrative. So if like say they wearing the leg gown, they might cause another secondary radiations, which is will be penetrated to their body, which is not good. That's why in the nuclear medicine procedure, all the workers are not suggested to wear the leg gown during the procedure. What they can do, just only limit the time with the patient, one, and also limit the time, and also take a distance during their preparing the patients. The safe or not, actually, their limit is 20 millisievert, Prof. If like say they exceed, okay, we will do further investigation by taking their blood to see if there is any changes in the blood or the cell. But however, I think until now, the workers who work in the nuclear medicine is not reach the 1/3 of the annual dose limit, 20 millisievert. So I can say it is safe. It is safe because they are classified as radiation worker. Like in Malaysia, they has a special where actually they have a radiation leave, 14 radiation leave on top of the annual leave for the radiation worker. I'm not sure the others countries, some of it, I think they got the extra allowance during because they are classified as a radiation worker.
Thank you. Thank you very much
Welcome.
for your detailed answer. I know that with the development of technology, I mean, the radiation detector's sensitivity is getting better and better. So with the low dose, you can still get better images. Yes.
Yes.
Thank you very much.
Welcome.
Actually, we also have some questions in our chat area. Cephas, are there training courses only focusing on radiation dosimetry in nuclear medicine at INSTA? I think this question goes to Dr. Hafiz about INSTA.
Okay. So I think at the moment, from what's being planned, so yeah, there's no specific course in nuclear medicine, but we'll cover the basic component in because normally the INSTA school would have an overview of that topic, not very specific in specific application.
Okay, another question from Arwa.
Xiaoqing.
Yes, please.
Xiaoqing, may I answer the question about the training courses? Because
Sure,
I
sure.
see, yeah, thank you. I see
Please.
several questions about the training courses, and I would like to clarify to everyone here. Thank you for the question showing interest of trainings in different specific areas in the area of radiation medicine. However, under the International Nuclear Science and Technology Academy, what they are providing is a overview of the applications like what Dr. Hafiz had presented. And this school is targeted for the lecturers of the different what you call specialty in radiation medicine. This is under the International Nuclear Science and Technology Academy. In the Asian Pacific region, we also have another education network called, which is organizing this webinar, Asian Network on Education and Training in Nuclear Technology. And ANEN, in its learning management system, do have a repository of different training courses. These are at this point in time self-learning, and you may want to enter into ANEN website and go to its LMS to get more information on the materials that they have. If you would like to have a special training provided either online or face-to-face, you can post those interest either to ANEN or to INSTA for them to consider to organize as part of the activities. So I hope it's clear. Back to you, Zaujin.
Thank you. Thank you, Marina. Yeah, I think the students can understand. You can also visit ANENT LMS for more courses. We have another question from Arwa. He's asking if you are providing master's degree in your school. I think Dr. Hafiz, would you like to answer?
In our school, in University of Science Malaysia, we offer master's degree in medical physics by coursework as well as by research mode. So you are welcome to contact me if you are interested to enroll in this degree. I think in other universities in Malaysia, there are also other courses, for example, Masters in Medical Imaging that is focused for the radiation technologies. And I think in UPM as well, they have Masters by research mode that you can enroll into in this area. Yeah.
In my, as I mentioned by Dr. Hafiz, in my university, we just offer the master and PhD in medical physics, particularly focusing more to the radiation dosimetry.
Okay. Next, we have several questions from Amal from Indonesia to ask Dr. Nora.
Okay,
I'm sure Dr. Nora can also see the question. How many cyclotrons are there in Malaysia?
Oh, that one, I'm not pretty sure, but so far that I know, in my knowledge, two, we have in private and one in government. I'm not sure, Hafiz, do you know more than that? I think I know just only two. One is in National Cancer Institute, Malaysia, and also another one in the Beacon Medical Center. We have two. At the moment,
Yeah.
I'm not sure if there is others. Yeah.
Yeah.
In cyclotron-based radiopharmaceutical production carried out in Malaysia, yes. For example, that we produce the FDG, fluorine-18, in the National Cancer Institute. And number three is the GMP, yes. They need to have the GMP certifications for the cyclotron-based radiopharmaceutical productions.
Thank you. Another question from Buri. Are there radionuclide production courses provided or microdosimetry and radiobiology? I think this is a similar question to what Marina has answered. Yes. Also, any courses for radiation oncologists?
Hafiz, you want to answer
this
this?
is specific for Malaysia. So I mean, I think this depends on the country requirement. For example, in Malaysia, for you to work as a oncologist, so it's called a clinical oncologist. So they would take a master's by coursework in radiation in clinical oncology. So there's a university that's offering this course. So after they graduate from this, then they can work as a clinical oncologist. But there are some oncologists here that were trained in Australia. So in Australia, they have a master's degree in radiation oncology. So they also can work as an oncologist in Malaysia. But having said that, for people from other countries, so I think you can try contact the universities that offer this course in Malaysia. For example, for clinical oncology, it's offered under University of Malaya. So you contact Mr. Malaya to find out more. But if you don't need like a specialized course to become an oncologist in your country, so you can also attend like a postgraduate level short courses. For example, that the things that we offer here for you to be able to take the professional board exam, maybe from the UK, so you can take this exam to become certified as a clinical oncologist if your country accept that form of training. So it depends.
Okay, we have several more questions. I will make it faster. Another question from Nava. Is there a plan to implement proton therapy in Malaysia in the near future?
Yes, I think I'm not sure. I think Dr. Hafiz also know the history of the planning to have the proton therapy in Malaysia. Like in my university, also they plan to have it, but I think because the financial constraint, we are not able to proceed with that. I'm not sure, Hafiz, in your university, I heard that, yeah.
At the country level, I think there's always a plan to have this facility.
Mm.
But because the main workhorse of radiation therapy is currently still photon radiotherapy, so this is only would be available if there's funding, and because this technology is not suitable for all kind of cancer. It is useful for only certain type of cancer. So there's always this economics where you have to weigh between what's the benefit and the cost involved. So if for example, in most low middle income countries, so our main focus would have the highest priority is to have radiotherapy linac, photon radiotherapy across the country, so that all your patients will have easy access to these radiotherapy centers. The reason being is that radiotherapy involves treatment of multiple fractions. So, for example, for breast cancer, you need over 20 fractions of treatment. So, meaning that the patient has to go to the hospital daily over 20 fractions of the treatment. So, meaning that it will actually extend to over few weeks. So, if the center is far from the patient, then it will cause problem in terms of patient access. And this is also not good for carbon emission, right? Because patient has to travel far to get this treatment, and also maybe patient would hesitate to get this treatment if radiotherapy center is far from their center. So the main focus for low middle income country normally is to have as many as a radiotherapy facility feasible based on the number of populations that they have. I hope I answered the question though, very long. But
Yeah.
can all nationalities attend the school? Can I just
School.
read the next question? Yeah,
Financial
this is-
support.
so we will announce this. Yeah, and I think I forgot to mention that this school is actually part of the bigger Insta education program, where there is part 1 and part 2. I think Dr. Nora also involved with this, where the participant has to go first before you can enroll into this course. And it's open to all nationalities as well, but there's some requirement, prerequisite requirement before you can enter this Insta school.
Yep. And then the next question, Prof, how is the
Marina also
responsible?
wants to
Yeah,
add
Marina
on.
want to, okay, yep.
Yeah.
I
So
think Marina want to add on to.
I would like to address the question on financial support. I think financial support is possible if the member states, or you come from a member states that do have a TC project on, for example, in this case, to strengthen the quality of the radiation medicine in your country. So this is an opportunity for you to request for a scientific visit to attend a school or a fellowship. So this is one of the modality that can be used if you require financial support from the IEA to attend the school. So, and I believe maybe some of you are aware about this, and if you are not aware, to participate in the IEA Technical Cooperation Project, where funding will be provided to build your capacity or the human resource in various areas. And in this case, in this webinar, we are talking about in human health. So each country do have a national liaison officer that you can reach out to get more information about this. Okay, back to you, Dr. Nora.
Okay, thank you, Puan Marina. So, and then about how is the responsible to perform the QC test for the nuclear medicine equipment, MPs, or the nuclear medicine technology. I think actually for the QC test is really depend. It is some of the tests actually done by the nuclear medicine technology, but most of the QC test has been performed by the medical physicists in nuclear medicine. Yeah, but in Malaysia, actually, we also have some requirement like we have to hire the third party to do the QC. But some of the medical physicists who actually are privileged to do their own QC, they will do that. But some of the hospital do not privileged to do that. They will hire the H class, which is the third party, to perform the QC.
Thank you. We also have another question from Saba from Iraq about linear accelerator. Yes, you can turn on your microphone to pose your question, please. Can you hear us, Saba? If not, I do not see any more question. Okay, finally, thank you. Thank you, Dr. Hafiz and Dr. Nora, for the excellent presentations. And I would like to announce our next webinar. As you can see in the chat box area, we will have another webinar about nuclear technology application from 2 professors from China, also from 2 universities, Shenzhen University and the University of South China. So welcome to join us next month, September the 13th, and at the same time. Thank you very much. And I can see another question in the chat area. How can we reach out to the responsible personnel for the school visit? And what is the procedure for applying?
I think what we can do now is maybe to fill in the questionnaire. There's a section to enter your email, and then we can probably share more information.
Yeah.
But I think
Yes.
Marina is also going to add something. That's all.
Okay.
That's all.
Also on top of what Dr. Hafiz had mentioned, please also watch out INSTA website. We will put on the Maru, if you can put on the chat box, INSTA website. INSTA, International Nuclear Science and Technology Academy, will be putting out posts on their website the requirement and announcement of this school and also other schools that they are planning for next year. Back to you, Xiao Jing.
Thank you. There is another question from Dr. Sheikh. Is there any way to collaborate with both of the professors? You can send emails to them.
Why not? Yeah,
Yes.
you send the email.
email.
Yeah.
Okay. Finally, I want to remind all of you, the participants, to save this picture of next webinar to your cell phone or to your computer. And welcome to join us next time. Thank you very much. I think this is the end of today's webinar. Welcome to join us next time. Bye-bye.